We're tracking a health alert for our area. There are now confirmed cases of measles connected to D.C. and Maryland. Thank you for joining us. I'm Leslie Foster.
And I'm Lorenzo Hall. So we know measles is highly contagious. So we are getting a lot of questions from you about this virus.
And we're getting some expert help to answer them. Dr. Alexandra Yance is an infectious disease specialist. She's joining us tonight from Children's National Hospital. Dr. Yance, thank you so much for being here with us tonight.
Thank you so much for having me.
Yeah, so first up, let's talk about the symptoms. What are they?
So measles usually starts with a several-day course of basic cold symptoms. So runny nose, cough, red, rashy eyes, and then about day 4 to 5 of symptoms, you get a bright red, angry rash that starts on your head and works its way down and out through the rest of your body.
It's the pretty distinguishing factor between measles and, say, some other virus. What's the first thing you should do if you suspect you have contracted measles?
If you are worried that you have measles, call your doctor. It's very, very contagious. We don't want people rushing off to get tested in crowded emergency rooms or places where there might be individuals that don't have established immunity. So call your doctor, talk to them first to get next steps.
Do you isolate yourself from family members as well if you think you have it, since it is so contagious?
As much as you practically can,
Okay.
In particular if you have young newborns or infants under the age of 1 year or immunocompromised older adults that are at higher risk for complications.
Yeah.
But otherwise, generally, most of your family hopefully has immunity.
Yeah.
It feels like some of the same kinds of practical things that we were doing to protect ourselves from COVID. It was a good test run for what we're dealing with right now.
Exactly, although we have a better history and know what measles looks like, for decades upon decades.
Yeah. All right, we're getting some questions from folks at home as well. Like we have this one from Cindy Way in Herndon, Virginia. She says, I had measles as a child in the 1960s. How likely am I to get it this time?
So we consider a past exposure or infection with measles to be largely protective. So she's considered immune and very unlikely that she would acquire it again.
I guess that has to give her some relief, and for folks who are vaccinated, some relief too. We've got another question. This one is coming in from Cal Lynn, and she wants to know, what is the recommended age for getting this vaccine or booster shot?
So routine recommendations for MMR, or measles, mumps, rubella vaccine, is at 1 year of age, and then for a second dose or booster at 4 to 6 years of age before entering the school system.
It's interesting that she says that about the age, because we did get a question from someone wondering about how young is too young to get this.
Yeah, so this one is from Madeline, who's asking, our 3-year-old is too young for the MMR vaccine. We're flying to London next month. His pediatrician says while he's concerned, but should we be okay with that destination? What about the airports?
So technically you can get your second dose of the MMR vaccine 28 days after the first. So if you're traveling internationally at a place where you're worried about acquisition or encountering someone with measles, you can get that second dose for extra protection. You may still need to repeat it in the recommended age window, because that's what studies show us leads to long-lasting immunity, but you could get some immediate protection. So I would consider, talking to their doctor and seeing if they could get that shot before they leave.
You're talking about travel. We're around the spring break season. We're in peak bloom season, pretty close here for cherry blossom season. There are tourists that are going to be coming not just from this country, but from around the world. What do we need to be doing, right, with respect to protecting ourselves from this very highly contagious airborne virus, I should say?
Really, really, checking on your immunity, making sure that you've been vaccinated. Most of us that were born or went through kindergarten after 1990 have had 2 doses, but you can confirm that hopefully with your doctor. If you were born a little bit earlier, there's a likely chance you maybe only got 1 dose, so talk to your doctor about maybe getting that second booster dose. And you need about 14 days from vaccination to optimal protection. So I think that's really wise for anybody that's even thinking about going out into the crowds and with the cherry blossoms to consider making sure they're protected. If you are sick, please stay home. If your kid has a rash, even if you don't think it's measles and a fever, talk to your doctor before you weigh going out into those crowds. Don't brush it off as, oh, it's allergies or it's just eczema.
Yeah. So what do you say to people at home who, you hear about someone with a confirmed measles case, and you may have been at one of those locations where those folks may have traveled at some point. What do you do?
Yeah, so the incubation period, or kind of period between exposure and development of symptoms of measles, is anywhere between 7 and 21 days. So there is a pretty long period that you are at risk for developing that infection. So continuing to monitor for that 3-week period for any development of symptoms. And at the first sign of a fever or a cold or a rash, calling your doctor or contacting the Department of Public Health about that exposure to learn about next steps for testing.
I know one of the common threads between all three is travel, right? It's been an Amtrak train, it's been an airport, and so we know that this virus is picking up and going where we're going. We've got a question from David, and he is wondering if there's a test that you can take to test if you're immune if you don't have access to your vaccine records, right? Some people have doctors who may not be with us anymore. So can you get a test to see where you are?
Yeah, there is an antibody test to look for the levels of antibodies against measles. That would be either from natural infection or from vaccination. However, it's not necessarily a quick turnaround time, and it doesn't guarantee immunity just because you have it. So our general recommendation is, if in doubt, go ahead and just get another dose of the MMR vaccine.
Some of these folks with measles, they've traveled to so many places in the area over a 2-week period. Do we need to bring back masks at this point? It reminds me of the pandemic, and you talk about how highly contagious measles is as well.
Yeah. I think on a personal level, if you feel safer wearing a mask, it is protective. This is an airborne disease through droplets, so it's never the wrong thing to do. However, right now, I think we've seen sporadic cases. There's a pretty good level of community protection from vaccination here. So I think the chances of this spreading into a broader outbreak are low, but always do what makes you feel most comfortable and most protected.
Dr. Yance, we have come through a long period of COVID and all these things that we have now sort of been learning to do in the midst of what's occurring, right? And so we've got measles now, and there may be some people who are pretty nervous about leaving their home and traveling and that kind of thing. I know you said the best protection is to make sure that you are vaccinated, but how do you help us with some anxiety that we might have just with another thing out in the universe swirling out there?
Yeah, I mean, you've all gotten a great education in infectious diseases over the past 5 years, that's for sure. And it is stressful. This is a part of my job, and we see this every day, and every time there's a new virus circulating elsewhere in the world, we wonder, is it going to come this way or not? I think important things to remember: while measles is very contagious, it is generally pretty mild, and especially if you're vaccinated, even if you acquire it, you're most likely not going to have problems. It's really that higher risk population, the very young, the immunocompromised, or the very old, that are at highest risk, and so they may want to be a little bit more careful. But outside of that, I think you should feel free to go about your day and just be smart if you get sick yourself.
Yeah, over the years, we hear about maybe 1 or 2 measles cases, depending on where you live. Is what we're seeing right now, is this abnormal?
So what we're seeing in the outbreak in Texas is somewhat abnormal. So to paint the picture, last year, 2024 and 2023, there was probably in the neighborhood of 200, 300 measles cases nationwide for the whole year. We've hit that mark in 3 months in Texas. And usually it is a bit more sporadic cases from people traveling internationally or here or there. So what we're seeing elsewhere in the country is pretty typical, but that outbreak is concerning.
Are there some people for whom getting this vaccine makes them a little nervous? And what do you say to people who may be on the fence about it?
Yeah, there are definitely individuals out there that have concerns about vaccination in general and the MMR vaccine as well. There have been numerous studies, and we've had this vaccine since 1968, I think, so very well studied, and the safety is established for this vaccine. But there are still some that worry about their child and risks of autism, which has been disproven, risks of getting sick or having that fever causing other problems, which are sort of equal across the board with infections and other things that cause fever. And so I generally say there are some risks, like there are risks to everything. There's a risk to me driving here today. There's a risk to all of us getting on an airplane. But the data has shown us that over the years, the benefits far, far, far outweigh the risk. So this is a safe vaccine. There are some people that cannot receive this because it is a live viral vaccine. So those with no immune system because of chemotherapy or an underlying disorder, cannot receive this vaccine safely. But everyone else, this is a very well-established safe vaccine.
And even if you do have the vaccine, you can still get measles. I'm thinking of the folks at home who may start to
Right.
show some of the symptoms and think, there's no way it can't be measles because I'm vaccinated, but it's still possible.
Yeah, it is still possible. It's about a 3% sort of breakthrough or vaccine failure rate, which is pretty good for sure. But yeah, it is still possible. So even if you are fully vaccinated and you start to see the fever and especially that characteristic rash, you should still call your doctor.
You've been an infectious disease specialist for years now, and at the point that you started studying, measles, we thought, was gone. And now it's come back. And we're talking about this again in this country.
Yeah, it is very sobering to see a resurgence of a disease that we thought was eradicated in this country in 2000. So hopefully we'll be able to reach that point again if people work together and get vaccines and protect each other.
What does that tell you when you see something like measles spreading? We're talking measles here.
Yeah, it really does, sort of follow the decreasing rates of immunization that we've been seeing across the board, especially since the COVID pandemic and all the unnecessary controversy surrounding that vaccine.
Do you believe that we have the infrastructure to handle these cases that are cropping up across our area, but not just here, across the country?
I do. I think at this phase, given, again, the level of protection that we have in this city, that the rates of hospitalization and severe disease are relatively low. But in communities where, it's more rural and like the outbreak in Texas, where they already have a shortage of healthcare providers and facilities, it is a significant tax on that system. So there are, I would say, more concerns in those settings.
But it sounds like you're also saying that at this point we should not panic.
Exactly. Yep. Just be aware. Use this time to make sure that you are as protected and set up as you can be in case this spreads further in this area. But I really don't, think that that's an issue for concern at the moment.
Dr. Alexandra Yantz from Children's National Hospital, thank you so much for being here with us, and thank you for answering these questions. We can't tell you how much of a relief I think this provides to people to be able to say, I've got this specific question, and we've got an expert here answering.
Yeah, my pleasure. Thank you.
And for the folks at home, we'll keep getting you answers as we track the impact of these measles cases in our community. Thank you for being here with us.